This presentation is part of the Pathology Master Series, developed by Brian Geniuson, founder, principal research scientist, and research systems architect at Natural Scientifics. Pathology examines how biological systems lose regulatory stability and transition into disease. Rather than focusing on diagnostic labels, pathology investigates the underlying failure dynamics that unfold across molecular, cellular, tissue, and organ systems. The framework presented here maps the progression from healthy physiology through physiological stress and compensation into pathophysiology, maladaptation, and ultimately established pathology and multi-system failure. This continuum applies across metabolic disease, immune dysfunction, infection, neurodegeneration, structural degeneration, and aging. Healthy physiology is adaptive rather than static. Energy production matches demand. Cellular signaling remains precise. Inflammatory responses activate when required and resolve appropriately. Structural components are continuously repaired. These regulatory processes allow biological systems to maintain stability in the presence of stress. As stress becomes persistent, systems enter physiological stress and compensation. Function is preserved, but regulatory efficiency declines. Metabolic pathways adjust, signaling thresholds shift, and immune activity remains partially engaged. Compensation maintains short-term stability while increasing long-term vulnerability. At the center of this architecture lies pathophysiology. Pathophysiology represents the mandatory transition zone between health and disease. It is the stage where regulatory mechanisms become distorted, but before irreversible damage is fully established. During this phase, metabolic pathways reroute substrates, immune responses fail to fully resolve, signaling fidelity declines, and structural tissues remodel under chronic load. Disease trajectories remain biologically modifiable at this stage. Surrounding this transition are 5 convergent failure domains that drive disease across conditions. These include energetic and metabolic stress, inflammatory and immune dysregulation, signaling and communication failure, structural and extracellular matrix degradation, and genetic, epigenetic, and repair system failure. Disease emerges when these domains interact and amplify one another rather than remaining isolated. As compensation becomes maladaptive, systems progress into established pathology. Feedback loops that once restored balance now reinforce dysfunction. Repair systems become saturated, damage accumulates, and multiple physiological systems begin to fail in parallel. This network-level collapse explains why advanced disease rarely affects a single organ in isolation. The Pathology Master Series is organized into dedicated subseries, each applying this shared systems framework to specific disease contexts. These include Pathophysiology, which examines the transition from normal physiology to dysfunction; Metabolic Pathology, focused on energy failure, insulin resistance, and substrate imbalance; Inflammatory and Immune-Mediated Pathology, addressing chronic inflammation and immune dysregulation; Infectious and Viral Pathology, exploring host pathogen interactions and immune-driven tissue damage; Neurodegenerative Pathology, centered on protein misfolding, synaptic failure, and neural energy collapse; Structural and Extracellular Matrix Pathology, examining fibrosis, tissue stiffness, and biomechanical signaling failure; and Aging-Associated System Failure, where cumulative damage overwhelms repair capacity across multiple systems. Together, these subseries allow pathology to be understood as an interconnected biological process rather than a collection of isolated diagnoses, tracing disease from early regulatory distortion through advanced multi-system dysfunction. Medical and educational disclaimer: the content presented is for educational and informational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. The information reflects systems-level scientific research and should not be interpreted as medical advice. Always consult qualified healthcare professionals regarding medical decisions or conditions.